In our experience, we find most patients are best served trying to keep the teeth that they have. And when it comes to periodontal disease, oftentimes patients have had experiences with periodontal disease treatments that have been painful. They've had a lot of downtime. I think it's important as dentists to always try to save patients' teeth when possible and when it makes sense. I can typically not do better than what nature gave you. I always tell patients that dental implant treatments, although they're great, they're not a replacement for your teeth, they're a replacement for no teeth. And oftentimes with conventional dentistry and other options such as LANAP, we can salvage someone's teeth at a fraction of the cost and disruption to their life as compared to dental implants. The laser that's used for LANAP is specific to periodontal disease treatment, and the laser has a certain characteristics that make it preferentially absorbed in inflamed tissue. Therefore, it leaves the healthy tissue intact, resulting in less recession and less shrinkage of the tissue after treatment. If you're confused as to whether you should remove all your teeth and replace them with dental implants, or you should attempt to treat the teeth, and if you're a candidate for LANAP, give us a call. We'd love to meet you and answer all your questions and get you started on a road to better health.